The examination of the limbs, the neck, and the back area. So the common clinical signs are lameness, ataxia, painful back, or abnormal or dangerous behavior during saddling or riding, and poor performance. Number one is take the history. Number two is take the specific examination of the limbs, neck, back region. Look for physical examination of the standing horse, the gait evaluation, and provocation tests. And third is the diagnostic imaging, X-ray, ultrasound, CT, MRI, and scintigraphy. Additionally, in the case of suspected disorder of the spinal column, complete the general physical examination and do a neurological examination. So number one, take the history, the breed, the age, the breed, the discipline, the purpose, when did the problem start, is it sudden onset, severity, consistency, any kind of change in severity during exercise or any kind of trauma, previous lameness, is there pain, any treatment or medication, and when was the horse last trimmed. And then there's axial skeleton, thoracic vertebrae, lumbar vertebrae, sacral vertebrae, and caudal vertebrae. Number two is the physical examination of the horse. Observation, so the limbs. Is there any kind of wounds, scars, posture, balance, symmetry, the position of the legs, does the elbow drop, is the fetlock drop, is there hyperextension? Loading more on the medial aspect of the hoof, is the angle, look at the angle of the joints, the tail position, is it kept it's mostly kept away from the painful leg? Look at the neck and back, is there any wounds, scars, is the position, posture, symmetry off? Is there torticollis, scoliosis, or muscle development or voluntary movement? Palpation, all four limbs, the neck and the back, detection of heat, swelling, tension, discomfort, depalpation for detection of muscle pain in the back region. And the movements, check the voluntary movements via offering feed, sideways, upways, downways. And then the gait evaluation, check for lameness, pain, or incoordination by walking and trot and riding if possible. And on a straight line, go curved and in circles on both hands and on soft and hard ground. So the diagnostic imaging. So x-rays, check the limbs, you can check the neck, the cervical column. In a standing horse, make sure it's sedated, have a lateral view and an oblique view. So the lateral ventral or lateral dorsal view for their articular processes. For the back, thoracic region, the lumbar region, the sacral vertebrae, it's challenging due to the deep thickness on x-rays. You can see the lateral view of the spinal processes, the vertebral bodies, and the ventral dorsal oblique view, you can see the articular processes. The myelography, so this is to see the subarachnoid space, arachnoid space. The aim is to check the spinal cord compression, so it requires general anesthesia, aseptic preparation. You withdraw 50 milliliters of cerebral spinal fluid, and you do it slowly within 3 minutes, and then elevate the horse to prevent the cranial passage of the contrast. Then you give the contrast medium into the vertebral columns at the atlanto-occipital joint, so cranial the atlantis, and you give opamidol, 50 mils, and 5 minutes the x-ray should be taken, lateral view, flex and extended position, as seen here, flex and extended. Ultrasound of the limbs and the ligament nuclei. MRI, so it's restricted for the limbs, head and cervical column. CT, it's restricted for the limbs, head and cervical column. And scintigraphy, the detection of fractures, inflammation and infections. And the possible findings are arthrosis of the vertebral column, kissing spine syndrome, so the process spinosus are in direct contact. Spondylosis is chronic degeneration of the ligament longitudinale ventralis. Osteomyelitis caused by bacteria, so by actinobacillus. Nerve root compression, and wobbler syndrome. This is the cervical vertebral malformation, resulting in compression of the spinal cord.